Hello, awesome staff of the Northwest Kidney Center. Shout out, of course, to the A team at the Kent Dialysis Unit, and this month to our excellent friends at CTEC as well. Today we're going to talk about the culture of ice consumption at dialysis units. As you all know, dialysis patients love their ice, sometimes to the detriment of their volume status. Why do we provide them with ice, and why do they love it so much? There are three objectives of today's talk. First, understand why many dialysis units provide ice for their patients. Two, appreciate the reasons why dialysis patients like ice so much. And three, recognize the potential negative consequences of ice consumption. I think it's best to begin the story of the ice saga with a discussion of volume management. As you all know, dialysis removes waste products from the blood, but it is also very important in removing fluid from the body. If dialysis patients do not remove enough fluid and sodium, then they retain fluid, and ultimately this leads to congestive heart failure, or the inability of the heart to adequately pump all of the blood in the circulatory system. In this setting, fluid backs up behind the heart and causes congestion in multiple organs, including the lungs, the abdomen, the legs, etc. And this is why our patients usually present with shortness of breath and swelling when they are retaining fluid. Volume overload is a major cause of morbidity and potentially mortality in dialysis patients. This is one of the studies that has demonstrated the high prevalence of the problem of volume overload in the ESRD population. It's a prospective study published in 2010 that looked at close to 200,000 prevalent hemodialysis patients followed for 2.5 years. What they found was that 14% of those patients required at least one hospitalization or more for fluid overload complicated by heart failure and fluid in the lungs called pulmonary edema, for which urgent dialysis needed to be performed. So, very common problem. Another study by Plantiga published in 2018 also illustrated the problem of recurrent volume overload among dialysis patients. It was an observational study of over 200,000 U.S. hemodialysis patients. What they found was that among patients who were hospitalized, 23% of them were rehospitalized within a 30-day period, and almost half of those, so 44%, was for pulmonary edema or fluid on the lungs. This is a chest x-ray, which basically shows pulmonary edema. Normally the lungs should look black on x-ray, but the fact that it's so white and hazy, all of that is what fluid looks like on x-ray. Another study published by McLaughlin in 2012 was basically a post hoc analysis of a very important study called the HEMO study. It was published in 2002. Basically, it was designed to look at the impact of dialysis adequacy on survival. Basically, they instead looked at the sodium intake of subjects, and what they found was that the more sodium the higher mortality you had. So dialysis patients who ingested more than 10 grams of sodium chloride exhibited a significantly higher cardiovascular mortality than patients who consumed less than that. Because volume overload is such a potentially big problem in dialysis units, staff, particularly the dietitians, work very hard to help people control their fluid intake. The main strategy is to reduce dietary sodium restrictions. Steps 1, 2, 3 are to convince patients not to eat salty food. If you don't eat salt, then you don't get thirsty, and then you don't drink a lot of water. But there are other non-pharmacologic strategies that dialysis units have employed to help reduce fluid intake. For example, making ice available to patients. Some dialysis units have employed programs of administering frozen strawberries or frozen grapes, basically things for people to suck on during dialysis rather than drink water. Some dialysis units have tried chewing gum, even artificial saliva, gargling with water. There's something called biofeedback, which has been tried. Basically, it's a technique that helps people learn to control their bodily functions, like their heart rate or their muscle tension. It essentially uses sensors and monitors to help individuals become more aware of their body's function and learn to consciously influence them. Group therapy and acupuncture have also been employed as strategies to help patients control their fluid intake. So let's discuss in more detail the strategy of administering ice to patients as a technique to help them minimize fluid intake. The general idea is that ice cubes melt slowly, so they satisfy oral cravings without contributing as much to volume as drinking liquids does. This can psychologically help patients. They feel like they're drinking something while ingesting less actual fluid. It's a safe, low cost, and simple intervention that may be useful for some patients who are really struggling with fluid restriction. There are very few studies which have demonstrated that ice consumption actually reduces fluid gains, but here are a couple. One was published by Maslam in 2013, looked at the effect of ice chips on thirst and fluid gains in between dialysis. It enrolled 49 patients, hemodialysis patients, who participated in a 6-week crossover trial. Essentially, the patients were randomly divided into two groups, Group A or Group B. Group A was instructed on how to alternate ice consumption with water consumption in between the dialysis treatments, and Group B was instructed only to use water. And then after 6 weeks, Group A and B switched. And what they found was no significant difference between the use of ice chips and the severity of thirst, but there was a slight decrease in interdialytic fluid intake in between dialysis sessions. So the group that only drank water consumed about 2,400 mils. The group that drank ice plus water consumed about 2.1 liters. But the latter group was more thirsty, so their thirst score worsened as a consequence of mixing in ice consumption along with their water. UNESC published a study in October 2023 that looked at the effect of ice cubes containing menthol on thirst in patients undergoing hemodialysis. This was a randomized controlled trial of 60 hemodialysis patients. 30 of the patients were randomized to ice cubes containing something called menthol every day. So they get 12 ice cubes per day for 1 week, and the other group got nothing. Menthol, by the way, is a chemical compound that can be extracted from mint plants like peppermint, or it can be created synthetically. And essentially, it's known for its cooling and refreshing sensations used in a bunch of products. The authors of the study then issued surveys to the patients looking at various factors like how thirsty they were, whether they had a dry mouth, how much food they consumed, etc. And what they found was that the mean score of duration of thirst, intensity of thirst, dry mouth, thirst discomfort, and how much food they consumed was significantly lower in the group that received the ice cubes containing menthol. So this is why many dialysis units have ice machines, so as to give the patients the ability to deal with thirst in a way that minimizes fluid gains. That said, if you are a new visitor to a dialysis unit, you may be struck by the number of patients eating ice during the dialysis procedure. Dialysis patients really seem to love their ice, almost to the point of psychological dependence or addiction. Why do dialysis patients love the ice so much? In researching this topic, I found a quote on the internet from a dialysis patient. I'm a dialysis patient, and all the patients in our unit are pretty hooked on ice. I used to like the flakes ice. I am onto the nugget cubelet ice. I want to buy a nugget ice maker, but my boyfriend is trying to discourage me since I take as much as I want from our dialysis unit. It's like going through horrible withdrawals when I'm out of ice. I literally have to ask my boyfriend to take me to the closest hospital near our house, and I ask for ice there. The ice there is the rabbit turd ice. It takes about 3 hours before the ice melts. I think ice stays fresher and longer in the paper cups. I'd foam cups with a small hint of water. I am anemic, and it's strange. When I received a kidney transplant, I lost all cravings for ice and could not stand the sight of it. Now, I can't get enough, but I do have to watch my food intake. I catch so many patients taking bags and bags of ice home. It's quite an addiction, but tastes so good. The strong affinity dialysis patients have for ice is a form of something known as pica, and that is the subject of the next part of the talk. Pica refers to the persistent, compulsive craving for and ingestive of both food and non-food items. Examples could be ice, hair, wood, metal, dirt, etc. This is a display of almost 1,500 items found in the stomach contents of a psychiatric patient with pica in 1929. Pica comes from the Latin word for magpie. It's a bird that is famous for its unusual eating behaviors. It's known to eat almost anything. In the winter, it'll eat more plant material, may also scavenge from chicken runs and pet foods, etc. But year-round, it'll eat decaying flesh of dead animals, catch small mammals and birds. Occasionally, magpies prey on larger animals such as young rabbits. They are a member of the crow family, and they are extremely intelligent birds. According to the DSM-4, or the Diagnostic and Statistical Manual of Mental Disorders, 4th edition, in order for the abnormal consumption of food to be considered, food or non-food items to be considered pica, they must, 1, persist for more than 1 month at an age where eating such objects is considered developmentally inappropriate. I mean, a baby, of course, can, eat dirt or something like that, but adults should not. It should not be part of a culturally sanctioned practice and has to be sufficiently severe to warrant clinical attention. So what are some examples of pica? Pagophagia comes from the Greek word pago, meaning ice, and phagos, to eat, refers to the consumption of ice. Trichophagia comes from the Greek word thrix, meaning hair, so it's the consumption of hair. Metallophagia is exactly what it sounds, a consumption of metal. Lithophagia comes from the Greek word lithos, meaning stone, phagos, to eat, so it's a consumption of stones. Here's some abdominal radiograph, and all of these white spots here are stones that this person has consumed. Coprophagia comes from the Greek word kopro, meaning stool or dung, refers to eating feces. Metaphagia refers to eating vomit. Urophagia, like it sounds, refers to the consumption of urine. And the list wouldn't be complete, of course, without including hematophagia, which refers to drinking blood or vampirism. Finally, geophagia. Geo means earth, so it refers to the consumption of earth. So why do people engage in pica? Well, there are 4 proposed reasons. 1, mineral deficiency. 2, psychiatric disorders. 3, stressors. And 4, the influence of culture. So mineral deficiency may drive pica in some cases. So often the substance eaten by someone with pica contains a mineral in which the individual is deficient. An example is iron deficiency. A lot of people eat soil that is rich in iron, and it may help them correct their iron deficiency. Also, a lot of people who have iron deficiency eat ice. Now, there's no iron in ice, so why they eat ice, I'm not exactly sure, but it's been well shown in several studies. In one study published by the American Journal of Medicine in 2005, 73% of the patients reported consumption of ice. Another study published in Blood in 2014 found that 65% of iron deficient subjects reported regularly chewing ice. And this is particularly relevant in the dialysis population in which iron deficiency is common. So iron deficiency or disorders of iron metabolism may stimulate or drive pagophagia in the dialysis population. Psychiatric disorders may also underlie pica. Some people have something called obsessive compulsive disorder. It's basically a chronic medical condition characterized by a pattern of unwanted and intrusive thoughts or urges, and sometimes those urges can make people do certain things like eat soil or eat starch balls or eat ice. A lot of people also have sort of an addictive personality disorders. You recall from that earlier vignette that I described on the internet, this person was addicted to ice, and she didn't get ice, she would go to the hospital to get it. Stress may drive people to engage in pica behavior. It can be physical or emotional trauma, family issues, could be pregnancy. Most of us have known pregnant women who have had certain dietary urges, and those could be driven in part by the stress of pregnancy. The culture in which you live may also contribute to pica behavior. Some societies believe that certain substances impart therapeutic or magical qualities, like eating dirt. There is certainly a culture of ice consumption in dialysis unit, and people look around, see everyone else eating ice, so they decide to eat ice. So your peers, their behavior may influence yours as well. Geophagia is a common practice in many parts of the world. In the 1800s, it was common among the slave population in the southern United States and also common in parts of western Africa. In the 1900s, it was discovered that white clay or kaolin rocks have anti-diarrheal properties. It's thought that the clay may absorb certain toxins, and that led to the pharmacological commercialization of kaolinite, which is a clay material contained in kaolin, and that's an active ingredient in anti-diarrheal drugs such as kaopectate and Pepto-Bismol. In the southern United States, many pregnant women have been taught by their friends that eating clay, cornstarch, or baking soda can help with nausea as well as swelling of legs and can help ensure that you have beautiful children. So, how prevalent is pica in the dialysis population? Well, Biala published an observational study of chronic hemodialysis patients in 2001. This was a medical school affiliated dialysis unit. All of the patients were African American with an age range of 37 to 78 years. 30 patients admitted to some form of pica. So at the start of the study, 21% of patients admitted to some sort of pica behavior. But with time on dialysis, 47% of the patients with no prior history of pica were found to have developed the habit. So in this study, up to half of the patients developed pica behavior. Ward published a prospective study looking at pica behavior in 1999. These were incident dialysis patients, 226 who began chronic dialysis in Atlanta, Georgia between 1996 and 1997. 16% of the sample initially reported pica, more prominent in young women and African Americans. Approximately two-thirds of the patients who reported pica behavior craved and excessively consumed ice. The remainder craved and consumed starch, dirt, flour, and aspirin. The patients who had pica syndrome tended to have higher phosphorus, lower hemoglobin, and greater intradialytic fluid gains than those who did not have pica. Katsufis published a study in November of 2012. It was a survey of dialysis patients, and they found that 46% of patients experienced pica. About the majority of them had pagophagia, so consumption of ice, versus 12.6% consumed other things. Those other things included the consumption of chalk, starch, sugar, soap, sand, clay, Ajax cleanser, that can't be good for you, sponge, wood, and potting soil. Patients on hemodialysis were 8.3 times more likely to have hard pica compared with those on peritoneal dialysis. Greater than 5 years on dialysis was associated with a 3.2 odds ratio of having pica, so the longer you're on dialysis, the more likely you are to develop pica. And anemia is the most significant morbid association in those with pica. So patients had a fourfold increased risk of being anemic if they, for all types of pica, and a tenfold increased odds of having anemia for hard pica. So pathologic eating of both food and non-food substances in general is not good for you. The main complication that we worry about with ice is volume overload. So some patients on dialysis can consume several liters of ice in between treatments. It's not uncommon for dialysis patients to come to dialysis unit, fill up a cooler, and bring the ice home with them. Of course, there could be dental concerns. You chew a hard substance like ice, you can get enamel damage, cracked or chipped teeth, gum injuries, something called temporomandibular joint syndrome. There can be metabolic disturbances. There have been case reports of life-threatening hyperkalemia as a result of geophagia in hemodialysis patients. And of course, depending on what you eat, you're at risk for poisoning, nutritional concerns, bowel obstruction, perforations, and parasitic infections. Let's review what we've learned today. So volume overload is a major cause of morbidity among dialysis patients. Many dialysis units have therefore adopted ice machines to help patients deal with thirst. There are very limited data to suggest that consumption of ice chips actually reduces intradialytic weight gain. Dialysis patients seem to have a very strong affinity for ice, consistent with pica. There are four reasons that have been postulated for pica in general, but also particularly among dialysis patients. Mineral deficiencies such as iron, psychiatric disorders, stress, and culture. The prevalence of pica among dialysis patients is high, up to 50% in some studies. And potential complications of pica include volume overload, dental injury, metabolic disturbances, nutritional deficiency, bowel obstructions and perforations, as well as parasitic infections. Okay, time for the monthly quiz. Question number one, what is a medical term for disordered consumption of ice? That's right. So pagophagia. Pag is the Greek word for ice. Phagia to consume. So pagophagia. Question number two, what mineral deficiency is most commonly associated with the consumption of ice? That's right, iron deficiency. And this is a photo of red earth, which is red because of the high iron content. Question number 3, what is the prevalence of pica among dialysis patients? That's right, depending on the study, anywhere from 20 to 50%. Question number 4, name 3 potential complications of pica in dialysis patients. There are so many. Volume overload, dental injury, metabolic disturbances, nutritional deficiency, bowel obstructions and perforations, and parasitic infections. Final question, is pica more common among hemodialysis or peritoneal dialysis patients? That's right. Hemodialysis patients are more likely to have pica. In one study, they were 8 times more likely than peritoneal dialysis patients to have pica syndrome. This concludes the July 2025 in service for the Northwest Kidney Center. Thank you so much for your attention and for all of your care of our patients. This is Andy Brokenbrough signing out until next month. Take care.